Today, I'm going to discuss the second part, okay? We start with the definition, with type of indices and their uses, properties, and classification accordingly, the purposes and clinical trials, some terminologies, and we have a lot of indices using nowadays for purpose of planning or survey. Starting with the simplest one maybe, and the oldest one, which is plug index. It is very simple if you understand the concept. Plug index is proposed by Silnes and Law, the name of two scientists that discover or propose using of plug index. It's a very old one in 1964. So usually when you say plug index, you have to say plug index by Silnes and Law in 1964. The purpose for the use of plug index is to assess the thickness of plug from its name. We want to assess the thickness of plug on the tooth surface. Scientifically, we can't just say that this patient have plug. No, we have to have a measurable value. As we mentioned before, the indices is to change our speech and our uh, any condition into numbers, and these numbers have its meaning. So we assess the thickness of the plug at the gingival area. You know, we have incisal area or occlusal area, we have middle area, and we have gingival area for the teeth. It is the area near the gingival sulcus, near the gingiva. So we assess the plug present in that area. For which tooth will be selected? The entire dentition, or sometimes selected teeth can be evaluated. But it will be better to examine entire dentition, means all teeth present. And which area will be examined? We have to examine 4 areas. For each tooth, we examine distal, facial, mesial, and lingual surface for each tooth. Means for plug index, all teeth examined and 4 surface per tooth should be examined. The procedure. What is the procedure for plug index? I think Dr. Huda will explain it for you, and we will follow together, go together in this lecture. The indices is very important. Procedure for using or for measuring plug. First, we have to dry the teeth and see visually by our eyes using good light, adequate light. We have mouth mirror and probe or explorer. We have mouth mirror with the right side and probe and explorer with the left hand. Then evaluate bacterial plaque by moving the probe on the cervical third, on the gingival third of the tooth surface. For each tooth, four surface will examine. Pay no attention to plaque that extend to the middle or incisal. It's not our work. Our work is to see how much plaque is there on the gingival third. Probe to test the surface when no plaque is visible. Pass the probe across the tooth surface. Passing probe across the tooth surface. So if there is no plaque, the score will be 0. No plaque means plug index 0. When plug adheres, score of 1 is assigned. When we move the probe on the tooth surface, gingival third, and see that there is something on the probe, very small amount, it means 1. It means 1. And when we use plug index and gingival index, plug index and gingival index, we have to avoid using disclosing agent because it changes the color of gingiva also in addition to the color of the tooth. So why disclosing agent and what is disclosing agent? Disclosing agent is any colored material that gargled in the mouth. Ask the patient to gargle, then spit out. Then when he opened his mouth, we can see the plug colored very darkly, darker than the normal teeth. This will help us to know if there is plaque or not. Okay, and the criteria is very simple. We have to know these 3 or 4 numbers. 0 plug index means no plaque. 1 is a film of plaque adhering to the free gingival margin, a film of plaque. 2 means moderate accumulation of plaque, again within gingival pocket or gingival film. 3 means abundance of soft matter within gingival pocket or gingival margin. So the criteria is range between 0 to 3. 0 no plaque, 1 thin film of plaque adhere to the free gingival margin, 2 is moderate accumulation of soft deposit, and 3 is abundance, means a lot of plaque within gingival pocket. Can I ask if all of you follow, please? Are you with me?
دكتورة.
Okay, so plug index, why we use plug index? To assess the thickness of plug. Okay?
Doctor,
Yes.
it's only related to the gingival cells of the tooth.
Okay.
I mean, we just examine all the faces of the tooth only in the gingival aspect.
In the gingival aspect, examine distal, facial, mesial, and lingual. Just gingival area. Means that each tooth will have 4 numbers. Okay? 4 numbers.
Okay.
And شلون راح نحسبها? We will total these 4 numbers and divide it by 4. It's very simple.
You mean each number related to one face of the tooth?
Yes, we have 4 numbers for each tooth. We totaled this 4 number and divided by 4. تنطينا المعدل. صح?
Yes.
Yes. Okay. Now we will explain in brief. You can see here how we examine. The teeth is very clean. There is no plaque, means 0. Grade 0 plaque. 1 means thin plaque layer at gingival margin. See the probe and see the gingival margin. Just thin layer on the probe when we move the probe on the tooth surface. And 2, there is moderate layer. 3 means abundant layer, a large amount, as you see in this figure. Then, how to calculate the index? It's very easy and explained here. The plaque will be from 0 to 3, no more than this number, as I explained it. Plaque index for a tooth is by totaling the 4 number divided by 4. I think this one is clear. سن واحد 4 أرقام. نجمع ال4 أرقام and divide it by 4. This gives the mean. It means that for each tooth we have 1 number. Then, plug index for group of teeth means that this one number for each teeth total together and divided again by the number of group of teeth. If we examine 10 teeth, then the 10 number is totaled and divided by 10. Okay, if we examine 5 teeth, what will we do? Anyone can answer? If we examine 5 teeth, then the score for each teeth are added together and divided by 5. If 12, total the number and divide by 12. It's very easy. جمع الأرقام والقسمة على رقم الأسنان، عدد الأسنان. Okay, plug index for individual means indexes for each teeth added and divided by total number of the examined teeth. If we want a plug index for a group of people, then all indices are totaled and divided by number of individuals. It's very easy. جمع وقسمة على الرقم الموجود. Do you understand?
Yes, doctor.
Okay. Just total the number and divided by surface examined. Total the number and divided by the teeth examined. Total the number and divided by number of individual. عملية حسابية, very simple. Interpretation. If we have 0, it means that we have excellent case. No plug, so excellent. If,
Doctor?
yes,
Please.
yes.
How we can take the average for more than one individual if every person has a different
Yes.
state or different state?
Yes. This one means that you did a survey. For example, I will come to Al-Kitab University and want to know what's the scores for plug index in 3rd grade students of dentistry. I'm going to examine your teeth and give you a score. What's your name? طالبة سألتني. أسل. You have, for example, 24 teeth. I will examine each tooth in your mouth. Each tooth have 4 number. This 4 number, at the same time, I will divide it by 4. So each tooth will have 1 number. At the end, we have 24 number. Yes?
I'm divided by 24.
I will divide the summation of this number by 24. So you have now 1 score. For example, if you have number 1 or 0.1, I mean, if the score of your examination is 0.1, so you will take 0.1 in your hand. Your friend have 0.2. Others have, for example, 2 or 3. What else? The plug index for your group is by summation of your numbers dividing by your group. If I examine 10, then the summation will be divided by 10. And the result will be from 0 to 3. ما تقبل غلط. The result will be from 0 to 3. 0 means you are excellent. Good oral hygiene. If from 0.1 to 0.9 means good hygiene. From 1 to 1.9 شوفوا التكملة يعني 0.1 0.9 1 to 1.9 mean fair متوسط. From 2 to 3 means poor. You have to clean your teeth. You have to brush more. You have to correct your way of brushing. I think it's easy, but you have to read it more than one time. Okay? Thank you. Now, the scoring here is more discussed. The same as the table with simple clarification. Means for the area, the 4 area will score from 0 to 3. For a tooth divided by 4, for a group divided by number of the teeth, and etc. The rating again is the same of the previous slide. Excellent for 0, good for 1 to 0.1 to 0.9, fair point from 1 to 1.9, and poor oral hygiene from 2 to 3. That's all about plug index. That's all about plug index. Do you get it? Okay. Now we will go to the second one. I like this index. It's very simple, very nice, and very easy to do. From the name, it is simplified. We have oral hygiene index, and we have then simplified oral hygiene index. It is simpler than oral hygiene index. So I will discuss the simplified oral hygiene index. This is proposed by كلها علماء مكتشفيها يعني دارسيها. فمن نقول plug index رأسا low and stillness 64 low and stillness. Simplified oral hygiene index is by Green and Vermeulen. Green and Vermeulen, again in 64. This is by Green and Vermeulen, 2 scientists. The purpose is to assess the oral clean lines, because it's about hygiene. How? By estimating the tooth surface covered with two terms, debris or calculus. راح نفحص debris وراح نفحص calculus. So مجموع الدبريز والكالكولس هي راح تحدد simplified oral hygiene index. A component. Oral hygiene index simplified has 2 components. Simplified debris index or simplified calculus index. You see, we have simplified debris index and simplified calculus index. The 2 scores may use separately. I want to know the calculus index or the debris index. But when we total these 2 numbers, the result will be oral hygiene index, simplified. So we measure debris index and we will measure calculus index. Summation of these 2 numbers will be simplified oral hygiene index اللي هي المختصر مالتها OHIS. This one is some comparison with the oral hygiene index. To simplify it for you, just I mentioned the difference. For example, oral hygiene index, the examiner should select a tooth with most debris and calculus in each sextant. The oral hygiene simplified assess 6 specific teeth. It means if the oral hygiene index اللي اكتشفوها قبل يعني قبل كلش the examiner himself should choose the worst one, that the tooth that have most debris and calculus for each sextant. Sextant, you know, the mouth is divided into 6 sextants. from premolar to posterior, from canine to canine, then canine to posterior for upper and for lower. So we have 6, yes, 6 sextant. But in simplified one, specific teeth examined اللي هو central وال6s, central والmolars. The 6 teeth. 6 teeth, central incisor 6 and 6, lower central incisor 6 and 6. That's why it's simpler. And number of surfaces in the oral hygiene, 12 surfaces are evaluated, and only 6 in simplified one. 6 surface in oral hygiene index simplified will be measured. The scoring for the oral hygiene index from 0 to 12, while in simplified one from 0 to 6. That's why it is simpler. Okay. Now, first we identify 6 specific teeth. 6 specific teeth. First, posterior, the first fully erupted tooth distal to each second premolar is examined. It means first molar. Distal to second molar, it means first molar. The facial surface of the maxillary molars and lingual surface of the mandibular molars are used. Although usually the first molars, the second or third molars may be used. If someone remove his first molar or extract his first molar, so second molar or third molar can be used instead of the missing one. Otherwise, we have to examine facial surface of maxillary molar and lingual surface for mandibular molars. Molars mean 2 upper and 2 lower. For anterior, the facial surfaces of maxillary right and mandibular left central. Maxillary right, mandibular left. You see? Means 616, 616. Okay, it's very easy. 6 teeth will be examined. And the extent, the score represents half the circumference of the selected teeth, including proximal surface to the contact area. Present half circumference, يعني not all the circumference, because we examine only facial. Facial, it means half, نص المحيط, بس facial surface of upper and lingual surface for lower. That's why it's called half circumference will be examined. And for qualification, at least 2 of 6 possible surfaces must have been examined for individual. Record debris score and calculus score. What is definition of oral debris? Oral debris يعني بقايا طعام هو is soft foreign matter on the surface of the teeth. Soft material remnant of food and consist of bacterial plaque, materia alba, and food debris. Any food debris will be colonized by bacteria. So it is materia alba. When it is very white and simply removed, it changed to plaque after few hours. It means colonization by bacteria, microorganisms. So debris mean plaque, materia alba, and food debris. It is soft deposit. And the dental explorer placed on the incisal third of the teeth and moved toward the gingival third according to the criteria. Do you remember the plaque index? We just measure the gingival third. But in this index, we start from incisal till the gingival. It means whole surface of the tooth will be examined. We'll examine. Now the criteria. Criteria for debris index simplified. 0, no debris or stain. 1, soft debris covering not more than 1/3 of the tooth. Not more than 1/3 يعني بس ثلث أو أقل. 2, soft debris covering more than 1/3 and not more than 2/3 يعني من الثلث لحد الثلثين. 3 هو soft debris covering more than 2/3 of the exposed surface يعني كله أكثر من ثلثين يعني all the teeth. So the criteria for oral debris simplified. 0, no debris. 1, soft debris not more than 1/3 of the tooth. 2, soft debris covering more than 1/3 but not more than 2/3. And 3, soft debris covering more than 2/3 of the exposed surface. Anyone can tell me the criteria, the numbering, even if you read it, no problem. Anyone can say what is 0 and what's 1, what's 2, what's 3, please? Yeah?
If we have 0.
Okay. 0 for what? For which index?
For debris.
Debris index simplified. 0 means?
No debris.
Okay.
And also, if we have 1
yes.
debris, that means we have not more than 1/3 of the
good
surface. That
good. And 2?
Also, if we have 2, that means we have more than 1/3 and less than 2/3 of the tooth surfaces.
What we have? Soft debris. Yes. Don't forget.
Yes.
Soft debris covering more than 1/3 but not more than 2/3.
Yes.
Good. 3?
Also, if we have 3 soft debris, that means all the surface, all the thirds, that means more than 2/3.
Yes. Good. Good. Very good. All of you understand that one? But you have to read it again. Even if you understand it, you have to read it again. Okay? And during a practical training with Dr. Huda, or even with me, I will be with you anytime or asking any questions. Okay, now calculus. We have debris score and calculus score. Now calculus. Calculus in Arabic هو التكلس. تكلس, okay? The definition of calculus is hard deposit. Now we finish the soft deposit that we examined, its debris. Now we have hard deposit of inorganic salts composed primarily of calcium. Calculus, calcium carbonate. Don't forget, calculus, calcium carbonate, calcium carbonate, and phosphate mixed with debris, microorganism, desquamated epithelial cell. It means that there is plaque, there is debris, and there is calcification. Why? Because there is in the oral cavity we have calcium carbonate, we have microorganisms, desquamated epithelia. This form calculus, if not removed, if remain for long period. So calculus is hard deposit. Hard deposit. Examination. The use of explorer again by visual examination for supragingival calculus deposit, and identify subgingival deposit by gently placing an explorer into distal gingival crevice, drawing subgingivally from the distal contact to the mesial contact. It means how you examine the presence of calculus or calculus index using Explorer. For supragingival, we can see it, so visual examination for supragingival. And for subgingival deposit, we use Explorer gently from distal to the mesial, يعني من البعيد للقريب examination. From distal contact area to the mesial contact area subgingivally. Because supragingival is very clear, no need to use Explorer. Then, criteria. Again, 0 if there is no calculus. 1 if we have supragingival calculus covering not more than 1/3 of the exposed tooth. The same as one before. Supragingival calculus covering not more than 1/3 of the exposed tooth. 2. Supragingival calculus covering more than 1/3 but not more than 2/3 of the exposed tooth. 3. Supragingival calculus covering more than 2/3 of the exposed teeth surface and heavy abundance of subgingival calculus around the cervical portion of the tooth. Now, anyone can repeat this criteria for me. You can read it. It's very easy, just like DBRIS, but this one is calculus.
Doctor?
Yeah.
So if it's 0, there is no calculus, so it's a good hygiene, you can say.
Yes.
And
Yes.
if it's 1 supragingival calculus, it's covering not more than 1/3 and not less 1/3.
Okay.
And
just
if
more
it's
than
2
1/3.
supragingival calculus, it's covering more than 1/3,
Okay.
but less than 2/3.
2/3. Good.
And if it's 3 supragingival calculus, it's covering like the whole tooth, the 3/3 of the tooth.
More than 2/3 plus what?
Yes.
Plus?
There's a heavy band of subgingival calculus around the cervical area.
Gingival. There is supragingival covering more than 2/3 plus subgingival calculus.
Yes.
Okay, thank you. And anyone else want to repeat with me? Boys, no boys today? No? Anyone else?
Okay.
Okay. Yes.
You want to examine the calculus index.
Criteria? Okay.
If we have 0,
Yes.
that means no calculus.
Okay.
And when, that means supragingival calculus for not more than 1/3 of
1/3.
the tooth.
Yes, that's right. 2.
Supragingival calculus, that means more than 1/3, but not more than
2/3.
2/3
Yes, of exposed tooth. And 3.
If we have 3 supragingival, that means more than 2/3, and also a heavy band of subgingival calculus
Yes.
around the cervical
Good.
surface.
Very good. Yes, thank you. Very good. Now scoring of oral hygiene for an individual. Now we have, as we mentioned before, oral hygiene index. It's a summation of DBRIS index with calculus index. It means the result will be oral hygiene index. Yes, yes.
That means we must examine the incisor to gingival depth of the tooth related to DBRIS index, and also the supragingival and subgingival related to
Yes.
calculus index.
Yes, exactly. Exactly. Very good. Exactly. Thank you for this comment. Oral hygiene index simplified for an individual, determining the simplified DBRIS index and simplified calculus index. We have to determine these two, and the summation of these two will be oral hygiene. First, divide the total scores by number of surface examined. Number of surface. If we examine 6 surface per tooth, then we divide it by 6. Okay? So for each tooth, again, we have one number, and we examine for each person 6 tooth. Molars in central molar, molar, central molar. This 6 number divided by 6. It's very simple. Debris index and calculus index value range from 0 to 3. From 0 to 3. So the simplified oral hygiene index, it is a combination of or combine the debris index with calculus index, so the value will range from 0 to 6, because the debris till 3 and the calculus till 3, the summation of the two value will be from 0 to 6. How we interpret it, you see now here. First molar, both sides, the facial surface, and the central incisor. For the lower, the lingual surface of molars and the central incisors, lower. For the upper, the left, and for lower is the right central incisor. It's very clear. You have to know these teeth that examine in oral hygiene index. How you measure? Debris index is the total score divided by number of surfaces. Very easy. Calculus index, again, total score divided by number of surfaces. And the oral hygiene index, simplified, is the summation of debris index plus calculus index. It's easy. The interpretation, how to interpret the number, because the number means something. So for debris index and calculus index and oral hygiene index, we have good, fair, poor. Good, fair, poor. Good debris index and calculus index from 0 to 0.6. Fair from 0.7 to 1.8, and poor from 1.9 to 3. The oral hygiene index simplified, starting from good oral hygiene, if from 0 to 1.2. 1.3 to 3 is fair. More than 3 is poor. More than 3 is poor. It means between 3 and 6, because no more than 6, not more than 6, the range between 0 and 6. But in debris and calculus, the range will be from 0 to 3. And with summation of both, the number will reach 6. Again, in the Amali, you can understand more. The calculation, again, is very easy. Total calculus score divided by number of tooth scored. For oral hygiene, debris index simplified, calculus index simplified will be collected together. Again, it's معادلات رياضية. Debris index, oral hygiene index, and the interpretation. Good oral hygiene, fair oral hygiene, and poor oral hygiene. Now you know that when someone say that I have good oral hygiene, it is just talking, just a speech. It is not scientific base. They have to examine their teeth, their gingiva, their plaque, their debris, and their calculus. Then there is number that represents something, can be interpreted with good or fair or poor. Oral hygiene index group computes the average of individual score by totaling the score and dividing by number of individuals. Again, if we examine, for example, 100%, 200%, each one have one number. These numbers totaled and divided by the number of individuals. This will be the range of oral hygiene. مرات تنطيك يعني مو figures حقيقية. مثلا أني good oral hygiene، اكو واحد fair، واكو مجموعة bad. من نجمع ونقسم يطلع لنا معدل، فمعدل انه هذول الناس fair oral hygiene، يعني راح نظلم الجود وراح نساعد الباد oral hygiene معنويا. فالمعدل دائما فد شيء تقريبي. And we have, is it enough for today or I'll continue? Do you think it's enough?
Yes, enough.
Enough? It's difficult? Is it difficult? Some difficulty, yeah? Okay, let's stop here in gingival index for the next week. Okay? Are you happy or no? Not happy? Are you happy? Do you want to repeat? Shall I repeat it for you today or maybe another day? Yeah. Okay. Plug. Which one? Plug. All lecture today? First one. Plug index. It is an index to assess thickness of plaque. Okay. The entire dentition will be examined to see if there's plaque or not. The criteria for plaque, طبعا الطريقة هي to move the explorer around the teeth, all surfaces of each teeth. And 0 if we have no plaque. 1 thin film of plaque adhere to the free gingival margin. For plaque, only gingival margin or gingival third of the tooth will be examined. And moderate if we have number 2, moderate accumulation of soft deposit within gingival pocket. 3 if there's abundance, يعني severe, of soft matter within gingival pocket or gingival margin. From 0 to 3. As there's a good clarification, he's using the explorer moving around the gingival margin and gingival third of the tooth. The calculation will be for each tooth we have 4 numbers. Summation of this 4 and divided by 4 will be a number per tooth. Number per tooth. If we want to know plaque index for group of teeth, then each number collected together, totaled together, and divided by number of the teeth. For individual, all examined teeth divided by number of teeth examined. And the score will be interpretation. If it is 0 means excellent. From 0.1 to 9 means good. From 1 to 1.9 means fair. From 2 to 3 means poor. Okay? And I want to examine you. What do you say? Give me a date for examination. The simplified oral hygiene index have 2 parts. Debris index simplified and calculus index simplified. Only 6 teeth were examined. Central incisor to first molar in upper, central incisor to first molar in lower, as it's clear in this photo. The facial surface for molars in the upper and lingual surface for molar in the lower will be assessed. And the score for criteria for debris is 0 if there is no debris, One, if there is soft debris covering not more than 1/3 of the tooth surface being examined. Two means soft debris covering more than 1/3 but not more than 2/3 of exposed tooth. And three, soft debris covering more than 2/3 of the exposed surface. And I will give you time to repeat the lecture. For next week, I will start with gingival index. Try to send your representative for examination. I want to examine you to help you. Otherwise, the examination will be very difficult. Yeah. So that's all for today. Thank you for your listening, your attention, your sharing, your comments, your questions. Thank you and have a good time and goodbye.